11. The nurse is assessing a comatose client receiving gastric tube feedings. Which of the following assessments requires an immediate response from the nurse? A. Decreased breath sounds in right lower lobe. B. Aspiration of a residual of 100 cc of formula. C. Decrease in bowel sounds. D. Urine output of 250 cc in past 8 hours. The correct answer is A. Decreased breath sounds in right lower lobe. The most common problem associated with enteral feedings is atelectasis. Maintain client at 30 degrees during feedings and monitor for signs of aspiration. Check for tube placement prior to each feeding or every 4 to 8 hours if continuous feeding. 12. The nurse is talking with the family of an 18-month-old newly diagnosed with retinoblastoma. A priority in communicating with the parents is: A. Discuss the need for genetic counseling. B. Inform them that combined therapy is seldom effective. C. Prepare for the child's permanent disfigurement. D. Suggest that total blindness may follow surgery. The correct answer is A. Discussing the need for genetic counseling. The hereditary aspects of this disease are well documented. While the parents focus on the needs of this child, they should be aware that the risk is high for future offspring. 13. The nurse is performing an assessment on a client who is cachectic and has developed an enterocutaneous fistula following surgery to relieve a small bowel obstruction. The client's total protein level is reported as 4.5. Which of the following would the nurse anticipate? A. Additional potassium will be given IV. B. Blood for coagulation studies will be drawn. C. Total parenteral nutrition (TPN) will be started. D. Serum lipase levels will be evaluated. The correct answer is C. Total parenteral nutrition (TPN) will be started. The client is not absorbing nutrients adequately as evidenced by the cachexia and low protein levels. A normal total serum protein level is 6.0–8.0. TPN will maintain a positive nitrogen balance in the client who is unable to digest and absorb nutrients adequately. 14. The nurse is teaching about nonsteroidal anti-inflammatory drugs to a group of arthritic clients. To minimize the side effects, the nurse should emphasize which of the following actions. A. Reporting joint stiffness in the morning. B. Taking the medication 1 hour before or 2 hours after meals. C. Using alcohol in moderation and less driving. D. Continuing to take aspirin for short-term relief. The correct answer is B. Taking the medication 1 hour before or 2 hours after meals. Taking the medication 1 hour before or 2 hours after meals will result in a more rapid effect. 15. Which approach is a priority for the nurse who works with clients from many different cultures? A. Speak at least 2 other languages of clients in the neighborhood. B. Learn about the cultures of clients who are most often encountered. C. Have a list of persons for referral when interaction with these clients occur. D. Recognize personal attitudes about cultural differences and real or expected biases. The correct answer is D. Recognize personal attitudes about cultural differences and real or expected biases. The nurse must discover personal attitudes, prejudices, and biases specific to different cultures. Sensitivity to these will affect interactions with clients and families across cultures. 16. A 35-year-old client of Puerto Rican American descent is diagnosed with ovarian cancer. The client states, "I refuse both radiation and chemotherapy because they are hot." The next action for the nurse to take is to A. Document the situation in the notes. B. Report the situation to the healthcare provider. C. Talk with the client's family about the situation. D. Ask the client to talk about the concerns about the hot treatments. The correct answer is D. Ask the client to talk about the concerns about the hot treatments. The hot-cold system is found among Mexican Americans, Puerto Ricans, and other Hispanic Latinos. Most foods, beverages, herbs, and medicines are categorized as hot or cold, which are symbolic designations and do not necessarily indicate temperature or spiciness. Care and treatment regimens can be negotiated with clients within this framework. 17. During a routine checkup, an insulin-dependent diabetic has his glycosylated hemoglobin checked. The results indicate a level of 11%. Based on this result, what teaching should the nurse emphasize? A. Rotation of injection sites. B. Insulin mixing and preparation. C. Daily blood sugar monitoring. D. Regular high-protein diet. The correct answer is C. Daily blood sugar monitoring. Normal hemoglobin A1C, glycosylated hemoglobin, level is 7 to 9%. Elevation indicates elevated glucose levels over time. 18. The nurse is assigned to care for 4 clients. Which of the following should be assessed immediately after hearing the report? A. The client with asthma who is now ready for discharge. B. The client with a peptic ulcer who has been vomiting all night. C. The client with chronic renal failure returning from dialysis. D. The client with pancreatitis who was admitted yesterday. The correct answer is B. The client with a peptic ulcer who has been vomiting all night. A perforated peptic ulcer could cause nausea, vomiting, and abdominal distension, and may be a life-threatening situation. The client should be assessed immediately and findings reported to the healthcare provider. 19. To prevent drug resistance common to tubercle bacilli, the nurse is aware that which of the following agents are usually added to drug therapy? A. Anti-inflammatory agent. B. High doses of B-complex vitamins. C. Aminoglycoside antibiotic. D. 2 anti-tuberculosis drugs. The correct answer is D. 2 anti-tuberculosis drugs. Resistance of the tubercle bacilli often occurs to a single antimicrobial agent. Therefore, therapy with multiple drugs over a long period of time helps to ensure eradication of the organism. 20. While assessing the vital signs in children, the nurse should know that the apical heart rate is preferred until the radial pulse can be accurately assessed at about what age? A. 1 year of age. B. 2 years of age. C. 3 years of age. D. 4 years of age. The correct answer is B. 2 years of age. A child should be at least 2 years of age to use the radial pulse to assess heart rate.